Have you been wondering about, the term unexplained infertility? Sometimes I, get confused with this because we obviously have an issue where a couple is trying to conceive for an extended period of time, is unsuccessful, so we know something's going on. But we often hear this diagnosis of unexplained infertility, and I feel like I'm hearing it more and more often. So I think this is probably one of the most frustrating things patients come in with when they tell me they have this diagnosis. I see the frustration in my patients, the way they talk, the way they're, addressing their difficulty of not being able to conceive. And it's also frustrating for me because when we just leave it to something like unexplained infertility, it just means that we haven't figured out what the cause or the issue is. And I think part of the issue is I think we put a lot of trust. Patients put a lot of trust when they get their testing done, their initial workup, their baseline fertility evaluation. I think there's this belief that we're getting everything tested and that anything that could ever interfere with reproductive outcomes or the ability to conceive or increase your chances of miscarriage or increase your chances of conceiving with something like all those factors are being checked, and that is most cases that's not the case. Where we're doing a very baseline test. We're checking for, an ultrasound, which will screen for things like fibroids. There's usually a fluid ultrasound, which will check for, a bit more detail. So if we're seeing any other lesions, if we're seeing any septums, if we're seeing, an arcuate uterus, if any anatomical abnormalities, we'll check for the baseline hormones. We may check for ovarian reserve, follicle count, AMH. Beyond that, what I've seen with unexplained infertility over the years is it's usually not just one factor that's causing the infertility, but instead it's usually a combination of multiple small things, which together, add up to a very difficult time trying to conceive. And it's often the case when we address a lot of these small factors, these, isolated pockets or ignored areas of fertility, so to say, that a lot of these patients may end up conceiving on their own, or they see much more improved outcomes with their following assisted reproductive technology, such as IVF or IUI. So, what are these areas? We often talk about new research that comes out on a monthly basis through our website, our research page, our email newsletter that goes out every week, and in these videos that we've recently started doing over the past few months. And one of these areas that we've been delving more deeply into is actually the gut microbiome. So, how do the type of bacteria in your digestive tract, in your intestines, impact fertility? And this is actually a very, I think, novel avenue of research, and it's something that's very exciting because it's something so simple that can be addressed usually through dietary changes, probiotics, and the introduction of something called prebiotics or different fibers to help optimize the gut microbiome to support fertility. And so there was a new research paper published in July of 2020 looking at the role of the gut microbiome and how it impacts specifically pregnancy rates with IVF. And so they took a sample from a stool sample from a group of fertile patients and patients experiencing infertility. And what they found was a vast difference in the type of bacteria that was growing. And in particular, what they found was that if there was an increase in phylum Vericomicrobia, then there was usually a greater chance of experiencing infertility. So these types of bacteria may contribute to a decreased pregnancy rate. Now, this research paper established a correlation, not causation, but it's important to recognize this correlation. It's a very important connection, and it's important to know that the biggest driver of your gut microbiome is actually your diet and the type of nutrients, fiber, prebiotics, and polyphenols we consume may have a huge impact on the type of bacteria that grows in our intestinal tract and affects that gut microbiome. So they did a trial and they checked, if these patients who have a lot of these unhealthy types of bacteria, what would happen if we gave them partially hydrolyzed guar gum which is a prebiotic and a soluble fiber. And they gave it in the form of a supplement. And what they found was that just by giving one fiber supplement, no other changes in diet, no other lifestyle changes, no probiotics, just this one fiber supplement, they found that they see an increase in the type of healthy bacteria that we were usually looking for in the gut, but particularly bifidobacterium, increased. It's the population of that bacteria definitely increased. And we see a decline in some of these unhealthy types of bacteria. And we see they saw that if we had a greater increase in bifidobacterium after taking this fiber supplement, those couples were much more likely to go on to get pregnant with IVF. So it's just starting to establish this, connection between the type of bacteria in the digestive tract and how it may impact um, outcomes with IVF. And we know that the type of bacteria in the gut seem to have a huge role on the immune system, the level of inflammation in the body, our glucose control, insulin sensitivity, our reabsorption of different hormones. And it can particularly, with PCOS, we talked about this in earlier videos, how having just higher concentrations of B. vulgaris and other bacteria seems to propagate that poor insulin sensitivity, blood sugar control, and increased systemic inflammation we see with PCOS, and how the role of certain antimicrobials and dietary changes may actually improve a lot of these fertility outcomes. So when it comes to unexplained infertility, gut microbiome is one of those important factors we're looking very closely at. And a lot of patients come in, everything's fine and very healthy. And as soon as we start talking about the digestive system, oh, well, I have a lot of gas, I'm usually constipated, or I have loose bowels, or it goes one to the other, it alternates a lot. I get a lot of acid reflux, I'm having, abdominal cramps. So there's a lot of these like vague digestive symptoms, which sometimes correlate with that dysbiosis, that poor, balance in the gut microbiome and the bacteria. So it's important to look at these factors, especially the gut microbiome among others, right? We're looking at the role of so many environmental factors and, we have to ask ourselves, why is fertility decreasing over the last 2 decades? Why is the bar for male fertility, normal sperm morphology, normal sperm motility concentration, we keep bringing that bar lower and lower. Like sperm morphology, back in the 90s, we said, it should be around 80%. Then we brought it to 50% in the early 2000s. Now our bar is 4%. And if we have 4%, we're okay. So we keep bringing that bar lower. And there's, reports of how motility may be about 50% on average what it was, 20 years ago. So we have to look at the role of these environmental factors, our diet, our these factors that we can change and we usually have large influence over, to see if a lot of these multiple factors might actually be the reason of why it's so difficult to conceive. And for many couples, we've seen that just addressing these factors, not only do they feel better physically, mentally, emotionally, they feel healthier, but also we usually see better outcomes in their next IVF or IUI. And that's not always the case, but it definitely has been a strong trend for a number of patients. So, it's important to talk to your healthcare provider, your general practitioner, and a naturopathic doctor to see how these factors may actually be influencing not just your fertility, overall health, but in particular, if you're experiencing unexplained fertility, to explore how this might be contributing to that.